Welcome to this Hall of Fame episode. And today we are talking with Dr. Sudhir Rakholia, and he is an MD and DNB in Gynaecology.
Yes, sir.
So welcome, Sudhir. Very proud of you. And what is the first thing that comes to mind whenever you are deciding IVF center खोलना है? आप पहले जॉब करते थे?
First of all, I would like to thank Doctorpreneur Academy, Dr. Sharma sir and Amit sir for guiding and for constant support, like in each and every step in my in the whole journey from routine practice to specialized, or we can say super specialized category. So मैं जब भी 2015 में पास आउट किया, तब से रूटीन ऑब्स्टेटिक प्रैक्टिस कर रहा था. बट वी नो डे बाय डे विथ यूज ऑफ सोशल मीडिया, डिजिटल थिंग एंड every aspect of marketing, we have to highlight ourselves to community for some, we have to catch some USP, or rather we can say some
Niche.
Yes, meet, and then we have to project in community. So Doctorpreneur Academy has guided like mentor in this my journey, and the vision I have acquired in 2019, but it has possible with the help of this academy in 2021. So 22 rather March I have opened my construction of this. My hospital has started in October 2021, but completed in March 2022, and since then I am practicing as a IVF consultant in Rajkot, Gujarat, and total investment from 80% I have taken a loan, and just 20% I have saving of mine I have used. And after in the process of construction and everything, both sir has guided, Pranav sir and M.Ch sir has guided me for right from installation of machine to which all thing I have to keep in mind during negotiation and everything. They have given me a 100% focus, or rather we can say they have kept close watch on each and every transaction, and I'm very thankful, or I very privileged to be a part of Doctorpreneur Academy. Thank you so much, sir. This vision will, or this clinic will not be accomplished without the help of the Doctorpreneur Academy or my mentor, Dr. Pranav sir and M.Ch sir. Thank you so much.
Thank you, Sudhir. Now let us go a little background in your life. And when we are finishing the MD or DNB, did you think that you will reach up to this level, or when was the thing that now I have to go become an entrepreneur? When did it come into your mind?
सर मैं MBBS मैंने शुरू से ही पढ़ाई, मेरी जो प्राइमरी स्कूल से ही पढ़ाई मेरी मैं my background is farmer, and I have further studied. I have done my post graduation. I have done from Armed Force Medical College, like Army, and then I became a gynecologist. Like it is coincident, or rather we can say a luck. So I have been associated with a mother, like first of all like farming, what we are my father is doing, then forces, like for country, and then for mother, like pregnant mother. So I was not wanted to be a, like I didn't wanted to take a gynecology subject. Rather, I wanted to be a psychiatrist, but turns out to be a gynecologist. because of family pressure and everything. But since then, I think the counseling and the interest in counseling and everything, I opt for fertility specialists, like in especially IVF for my future branch or my future career. After passed my post graduation in 2015, I have done 1 year senior residentship in private hospital in Baroda. From there I have learned how to communicate with patient. हम ऐसा होता है ना सर कि जो पढ़ाई किया है वो different है. When it comes to practical, then it is totally different thing. From I have learned from કે આ સામે વાળું પેશન્ટ બેઠું છે ટેબલ ઉપર, એ ટેબલ ઉપરથી ઓટી ટેબલ ઉપર કેમ પહોંચાડવું, that I have learned from the private practitioner in Baroda. And after that 4 year I have done in government medical college as a assistant professor.
Right.
The idea of IVF or idea of fertility clinic started in 2016, and when I was in Junagadh, and then I came to Rajkot for that vision. And then in 2017 I started saving my money for this future project, because it has a lot of cost, like the equipment and infrastructure is very costly, because we have to make some quality modular, ultra modular laboratory furniture, and the equipment are too costly for IVF setup. So in 2022 my dream or my dream project, rather my dream vision, which is hormone balanced life. The clinic of my clinic name is Hormone IVF, because everything in female linked to hormone, the root cause for any menstrual abnormality of a female, mostly due to hormonal
imbalance.
So I kept that name of my clinic. So purpose is to balance hormone, balance life.
Yeah, your organization is called Hormone IVF, right?
Yes, sir.
Very
yes,
unique
sir.
name.
So I have to do a hormone balance first. If patient will not conceive, then I will go for IVF. That's what I have concise my message in these two words. I will not do directly IVF to a patient when couple comes to me. First I will balance her hormone, and then will go for IVF.
So when you thought that I'll start an IVF clinic or IVF setup, then some challenges would have come in your mind. What type of skill set or mindset you should have?
Sir, mostly financial, because because of coming from a farmer background, you also know that the saving of my father is not like that. I can open in a short span. So whichever I have done of my saving and from my earning. So dream I have realized in 2016, and since then I'm from 2017 I was collecting, or I was saving money for that dream. And after that 2022 I have invested whatever saved amount I have invested, and then also I have to take on a loan from bank also. So bank finance plus personal saving, these two from these two aspects I have invested.
If there is a new graduate, somebody who has done the MD recently, and he wants to start an IVF clinic, so how should he go about?
Sir, before moving to IVF, first we have to keep general practice, or we can say routine practice, at least for 2 to 3 years. So that what happen कि આપણે पेशेंट हुई ना, हमारा मतलब जो पेशेंट हमारे पास आते हैं जनरली, हमको उसका मेंटालिटी, हमका उसको साइकोलॉजी, हमारे रीजन का क्या सोच है, वो सब एनालिसिस करना पड़ेगा. सीधा हम जैसे आईवीएफ करेंगे तो थोड़ा वेटिंग पीरियड ज्यादा आएगा. तो उससे अच्छा है कि पहले साइकोलॉजी देखो पेशेंट की, पेशेंट कितना मतलब आईवीएफ सेंटर मतलब शुरू करने से मेरा एरिया में कितना आईवीएफ साइकिल मेरा हो सकेगा, जिससे मेरा रिकरिंग कॉस्ट है या फिर कोई फिक्स्ड कॉस्ट है, तो वो सब में उसका वो जो है बैलेंस कर सकूं. तो everything has to be
So at least 3 years of practice or 3 years of understanding the market and
yes,
trying your hands on the
analysis
simple
करना.
things first.
Yes, sir.
Right.
We have to analyze the market as a whole, right? From patient to other clinic also, right? How many IVF center are there in Rajkot? What is the potential of a IVF center in Rajkot? What are the types of client or couple rather they are opting, or whether couple are coming too early or too late for IVF? This all thing has to be keep in mind.
So initially they should do both the practice. Initially, when they start IVF, they should continue their obstetric practice also.
Yes, sir.
They
Yes.
slowly go to the only IVF.
Obstetric is a bread and butter rather. Obstetric we should do day in and day out, sir. We should not like withhold. Rather, I can. If my focus is only IVF, I will switch over to IVF later on, but not in the initial part, because some running cost, rather a fixed cost can be balanced with obstetric practice simultaneously.
And are there any centers which you can get trained in IVF? Because in MD they don't teach IVF, na?
Yes, sir. Sir, AIT bill has come in this March 2022.
Right.
So AIT practice, or rather क्योंकि गवर्नमेंट को सर पॉपुलेशन कम करना है, और
Right.
गवर्नमेंट को ऐसा लग रहा है कि IVF सेंटर वाले बहुत पॉपुलेशन बढ़ा रहे हैं, ऐसा
Right.
उसको लग रहा है. So
Right.
they have done a strict rules. They have made a strict stringent criteria for establishing or for practicing IVF in reproductive medicine, the specialty. We have to do a registration for 5 years. The fees of registration is 2 lakh amount, like 2 lakh. So it is very difficult to do a practice in today's scenario, but the future is too bright for IVF, sir. Rather we can, because what is the thing is like the late marriages. You cannot avoid that.
Right. Right.
Environmental pollution. These are the some unavoidable factors which affects the hormones of female, and that couple has to underwent or has to think of IVF when there is no natural conception.
So are there any centers which train you for IVF?
Yes, sir. Yes, sir. There are many centers in Gujarat also, and in India also. There are many centers who are giving a fellowship, or rather their proper M.Ch is also is there in reproductive medicine.
Okay.
Like one medical college in Chennai, like Ramachandra Medical College, something like that. They are offering M.Ch seat in reproductive medicine.
Okay.
And rest other institute like Manipal Institute, Kasturba Medical College, there, Bangalore, this RGUHS, this UHS University, they are offering, like Gujarat University, they are offering fellowship program like 6 months, 1 year to up till 2 years. And FNB program is also there from National Board of Examination, for which we have to give a common entrance test for super specialty, and we have to qualify for that. I think 40-50 seats are there across the India to for doing fellowship in National Board in reproductive medicine.
So how is the IVF center? You're saying something?
Sir, eligibility for opening the IVF center, I should have a 3-year experience in IVF center, registered IVF center, with 50 oocyte retrieval. That oocyte retrieval is the procedure, the name of the procedure, which we are doing on a female patient, retrieving the oocyte from ovary. So that is, they have mentioned 50 oocyte retrieval procedure record with 3-year training in registered ART clinic. For this is the eligibility criteria for gynecologists to open a IVF center.
So 3 years you have to work before you get a degree.
Yes, definitely.
For a fellowship also.
Yes. Even if you are a super specialist, like you have done a M.Ch degree or fellowship, then also with that 3-year another practice, like
before you
private
start your
practice.
own setup.
Yes, sir. Before starting clinic. So
How? Yeah.
I have started in a like very gray zone. I may be barred from this criteria, but in future, near future, they will count everything.
Right. So you were just in the last
Yes,
moment you were
like
open.
my dream has like it has very, I have done in the critical
Gray
zone.
Yeah.
Rather.
How is the IVF clinic or IVF center different from a routine gynec or obstetric center? What does
Sir,
it extra have?
Yes, sir. Sir, what I have realized from my point of view, जो सर एक होता है ना कि जो जिसको प्रेगनेंसी होता है वो उसको सब लोग पता चल जाता है कि दिस लेडी इज प्रेग्नेंट, और जिनको नहीं होता है फीमेल में, जैसे सर हम भी बचपन में थे तो क्या हमारा पेरेंट्स जैसे कंपेयर करते हैं ना, तो हमारी जो साइकोलॉजी होती है ना सर, वो इट इज लाइक कंपैरिजन. तो when the pregnant patient sees non-pregnant patient, तो मतलब नॉन प्रेग्नेंट पेशेंट सीज प्रेग्नेंट पेशेंट, तो उनको ऐसा फील होता है कि मेरे पास नहीं है समथिंग, मतलब मुझे ये मेरा लेकिंग है ये पॉइंट. तो मैंने ऑब्स्टेट्रिक प्रैक्टिस से अलग इसलिए रखा दिस आईवीएफ सेंटर, बिकॉज पेशेंट नीड स्पेशल अटेंशन एंड स्पेशल नीड्स minimum 30 minutes to 45 minute counseling. Patient need more attention, or if I'm doing counseling of that couple, and in my waiting room some pregnant patient is waiting, then it's a bit difficult to explain me for them why they are waiting. So I have made a different clinic or different premises, different place for IVF clinic, rather doing in the same premises. अगर मैं चाहता तो कर सकता था उसी बिल्डिंग में, उस पे एक फ्लोर भी खाली था मेरा, बट क्या होता है सर, होता है ना कि दोनों को अलग रखो ताकि nobody sees each another.
Right.
और मैसेज ऐसा नेगेटिव मैसेज कन्वे ना हो उनको.
Okay. IVF requires a unique setup.
Yes, sir. IVF has a good infrastructure, because the cost of treatment starts from 70,000-80,000 till 1.5 2 lakh, something like that, for one couple, for one cycle.
Okay.
And the laboratory part, we require ultra modular, like modular lab with a wall should be made with proper sheets, puff panel, rather we say puff panel. HPL sheets are there, which are chemical resistant, dust free, easy to clean, scratch free, everything, sir. The VOC level is 0, and the lab should be the air quality should be maintained with air handling unit, constant 24/7. We have to keep on the AHU, air handling unit, which will filter the air up till 0.3 micron. Like the air is very pure, like class 100 in Cairo consensus. They have mentioned class 100. The air quality should be maintained in IVF lab. So for that we have to make this setup with a proper flooring also and proper roof also. The flooring will be of vinyl flooring, which is generally common in each every part of operation theater. But wall should be made of HPL, which is a material should be used for laboratory, IVF laboratory especially.
So first thing, you should get some training somewhere. Then you should work for 3 years for under somebody, and then you should start your own.
Yes.
And how much
senior practitioner rather?
How much does it cost a basic IVF center? If you think planning, then what is the cost and how it is divided?
Sir, first of all, there are two costs. One is like OPD and IPD infrastructure cost, and another is laboratory cost. These two are different. I would say interior, and another is laboratory equipment plus infrastructure laboratory. Right. So laboratory, from laboratory point of view, there are equipment cost and this modular OT cost. So we have to consider that too in laboratory aspect, and for interior aspect, we have to make for a different OPD section and IPD rooms, and medical store, of course, medical store and admin area.
Right. So overall cost is around?
Sir, overall cost beginning from 1.5 CR till up till 2.5 CR. depending on the choice of instrument which we are purchasing. Instrument, there are only two company in IVF sector. They are making IVF equipments.
Right.
So there are two company. One is Shivani, which is Indian company, and one is Origio, which is an international company. So if we are purchasing Shivani setup, so it is bit cheaper than Origio. The equipment cost range from 40 lakh to 70 lakh.
So what would you recommend, Indian or foreign?
Sir, we have to do a mixture of both.
Balance.
Some equipments are better like K system, which is pioneer in incubator. So the main heart of laboratory is incubator. So we should not compromise in incubator part. So one is CO2 incubator, one is K system, which is benchtop incubator. The two we have to purchase from foreign company, and rest machine like workstation and ICSI machine, we can purchase it from Shivani. Like we can book circuit.
So you took almost 80% loan and 20% saving, right?
Yes.
So how easy or difficult was the loan part?
Sir, loan part rather because of I have taken loan from a nationalized bank. So I have to wait for, I have waited for that near about 2.5 to 3 months.
Okay.
Before sanctioning, because the loan amount is too big for bank.
Yeah. And you had to give the project report to them.
Owner, sir. That's why.
You had to give some project report to them.
We have to give them a list of documents, including project reports, degree certificate, and some income sources, some source of income document. And I have mortgaged my property also for that reason.
As a collateral.
Yes, sir, as a collateral. And the rate of interest from my bank 7.2%.
So for the baby.
So how important is the digital media or internet website for the propagation of your marketing?
Sir, digital media, and I'm getting a good result from like Google My Business page, from Facebook and Instagram. So we have to keep doing new thing, or we have to research
Right.
more and more thing, and we have to make like slides, or like we can say reels or videos, small videos, or rather some thoughts, or we have to keep posting day in day out, and we have to keep live from our from our area.
So this new ITR, this new rule that has come, that is mainly the criteria is for the training as well as the site. Any other things is that?
Sir, other thing, infrastructure also, they have mentioned, like what I have said regarding the infrastructure of laboratory. They have kept in their ART bill that they have categorized IVF clinic into 3 parts, like level 1 ART clinic, level 2, and third is ART bank. So level 1 ART clinic, till that clinic can do a treatment up till IUI, like intrauterine insemination. Till that level 1 clinic can go for. From IVF and onward, I have to take registration for level 2 ART clinic, and for ART bank, if I want to take donor sperm or donor oocyte, then I have to take that from ART bank. So these 3 categorization they have made, and the qualification and the equipment criteria also they have mentioned that so and so clinic or level 2 ART clinic should have or should purchase this instrument. So they will definitely see a equipment part also,
right,
apart from infrastructure.
So it is more regularized, but they made it difficult.
Yes, it has become a like more regulatory, rather the proper way of practice. They have analyzed and they have labeled on bill.
So you joined us in January 22, right?
Yes, sir.
What was the stage then? And how is the journey with us? What has been the experience?
After that, after all this Hall of Fame, or I have regularly updating myself from this academy. I have attended all session in the all video which you have made, and that has helped me in this throughout my construction part till purchasing part also. It has helped me a lot for negotiation part, and how to go about, because I'm there is no backbone, or there is no the person behind me to say like you can go for this, you can go for that. But this academy, or rather Dr. Sharma sir and Ankit sir, has guided me for same.
And how about the instrument purchase? That was a very tricky part, right?
Yes, sir. Yes, sir. Because my instruments are it started from 20 lakh to 40 lakh. So only one instrument. 4 or 5 such instruments are there in my budget. So it is very critical, because 2 to 3 lakh, right from 2 to 3 lakh till 7 to 8 lakh, we can save from instrument purchasing aspect.
How has your website development and digital marketing helped you in the practice?
Sir, there are many inquiry that has come from social media, and it has helped me from website, because people are searching when they write the name of my clinic or my name, and they also search out for website. They'll also search for my Facebook profile and everything, my education, everything, every detail I have put my every detail on like website and Facebook also. So it is helping. It is definitely helping for patient, and that will help the patient to come to my clinic.
How important is your counseling part?
Counseling of a couple or a patient is very important in each and every private practice, and the two-way communication. You have made a video on that. That part has helped me in my day-to-day counseling, or when I am counseling some patient for operation, or for any other procedure.
So Sudhir, what is the 5-year plan? When are you starting a franchise?
Achha, sir, my plan is very big. From like I want to start a franchisee aspect. I will go with some group of doctor, like from Jamnagar. Like my nearby place is Jamnagar. So if I want to open in Jamnagar, I will search for 2 or 3 gynec, and I will collaborate with them, and we will have a backbone, and we will give them a backbone, and they run a clinic, something like that, like sandwich model, we can say that model. I am doing I am right now I am correcting that model,
streamlining the
studying
SOP and processes.
SOPs and procedure. I am studying, I am doing, and we will come out with that soon.
So if you had an option that you take somebody's franchise, because many companies are giving the franchise and starting on your own. So
Yes,
why
sir.
did you choose your own?
सर हमको क्या होता है सर, जो हमारा बाप दादा ने ऐसा सिखाया है, मम्मी पापा ने और मेरे दादा ने, कि खेत तो हमारा होना चाहिए, मतलब हमारे खेत में हम किसी को रख सकते हैं, बट खेत तो हमारा होना चाहिए जैसे.
Okay.
So with that mentality, hospital should be mine, or I should project, or rather because I am a like वो जो हम उसमें बोलते हैं ना सर, मैं बचपन में वो गैया चराता था, तो गैया से गायनेक बना ना सर, तो उसमें डेस्टिनी होगी, मतलब कुछ तो लिखा होगा मेरे नसीब में, इसलिए मैं अपने हिसाब से, मतलब मेरे इंडिविजुअल में जाना चाहूंगा, रादर किसी और का ड्रीम फुलफिल करने से अच्छा है मैं खुद का ड्रीम फुलफिल करूं, और मैं ज्यादा से ज्यादा आगे जाना चाहूंगा, और यही तक नहीं है मेरा सफर, और आगे जाने के लिए है.
So you're going for international patients and all?
Yes, definitely, because ART rules are very strict in India, but outside it is not like that. Outside it is very costly treatment. So if I can go on medical tourism, I will definitely earn much more than compared to Indian patients. But we'll definitely serve for India first, and then we can go with international franchisee also.
So what is your message for the gynecologists or other people who are planning to start an IVF center there in our academy? So what is your message for them?
सर मैं पहले ये बोलना चाहूँगा कि पहले माइंड में क्लियर होना चाहिए कि मुझे क्या करना है. लाइक द विजन शुड बी क्लियर, लाइक यू हैव हाईलाइटेड. तो विजन एक क्लियर होगा सर, तो एक अंदर सबकॉन्शियस माइंड में वो बैठ जाएगा. जैसे मैंने 2016 में वो विजन देखा था, तो उसके बाद वो मतलब अपने आप बाकी का है ना सर, वो ऑटोमेटिकली सब हो जाता है. बट वी हैव टू सेट सम गोल और विजन, एंड वी हैव टू keep on doing and doing, because as we are in medical practice right from 12th standard, we are studying something like that. We have to do work doing and doing, and keep goal of 5 to 10 years like ahead from the today's from today point.
So we'll be diverting some of the people who will get some guidance from you.
Definitely,
so
definitely.
Whenever you are having free time, you just guide them.
You have realized my English is not because I am counseling my patient in Gujarati, like in a
day in, day out
smooth way, because so my
language will not be a barrier, don't worry.
I have studied till 12th standard in Gujarati, so my English is not like smooth English, rather my Gujarati is too smooth.
Don't worry about that.
As a patient will capture my message.
Yeah,
definitely.
No, message is always conveyed, and fantastic. It has been a great journey with you, and you are a good inspiration for many people.
Sir, another aspect of my this thing, like hormone, which I have said you, the vision, hormone balance, and another aspect of my practice is also I want to balance the society, because I am the person who is doing the deliveries day in and day out, and I am the person who is encountering the patient who demands for something like male child, something like that. और सर अभी क्या हो रहा है, एक बच्चा आ जाए ना, उसके बाद सब स्टॉप कर दे रहे हैं. तो इट इज अलार्मिंग फॉर सोसाइटी कि जो बैलेंस हम नेचर हमको 2 आंखें दे रहा है, 2 कान दे रहा है, 2 हाथ दे रहा है, 2 पैर दे रहा है, कुछ तो होगा. तो मैं भी पेशेंट को ऐसा बोलूंगा, एक अगर मेल चाइल्ड आ जाएगा, जैसे गुजरात में क्या है सर, एक मेल चाइल्ड आ गया, उसके बाद आगे बच्चा नहीं करेंगे. तो इट इज तो IVF मतलब मैं जो स्पेशलिटी में हूँ फर्टिलिटी में, तो हमारे पास जो इनफर्टिलिटी वाले पेशेंट आते हैं, तो मुझे ऐसा लगेगा कि मेरा काम कुछ तो बैलेंस करने में, क्योंकि जो लोग एक करके रुक जा रहे हैं, तो मैं उसका बैलेंस ये IVF करने से मेरा बैलेंस में कर रहा हूँ. ऐसा मेरी सोच है. माय पर्सनल थिंग, I am balancing the society, something like that.
There is a good amount of spirituality also involved with you.
Yes sir, definitely.
Good. So it was fantastic talking to you. We are really proud of you, and you will do well, and multiple branches you open, and you are franchisee of hormone IVF very soon.
Sir, I have made a name hormone, rather we can say because when I collaborate with some hospital, like I'll just put my name after that, the hospital name, rather thyroid hormone, something like that, because hormone comes after that.
Yeah, that is a good idea.
And hormone is the thing which comes in a group. Hormone should not be a individual, or hormone is not one single thing. Right. It is in group. So we will come out with a good team of member, or a good team.
So you are also in a leadership role, so you have to be a leader also now.
Thank you, sir.
Before we depart, Sudhir wants to show a tagline for him, what he has covered and what he tells all the patients and patient relative. He says it's Nathi Ma, so we'll explain that.
Yes, sir. My objective, or rather on what basis I am doing my work, I am showing patient my what is my inner sense, or rather my spirituality. I am showing them like you can become a mother from negativity. Like that's why in Gujarati we call it nathi ma sudhi.
Right. From nothing to mother.
Yes, sir. The journey of lady from no to mother, like from in no, there are many hurdles or many difficulties are there, and when that lady becomes mother, then the line will become a smooth. Everything become a smooth.
Right. Fantastic. Fantastic. A lot of imagination and creativity is there.
Yes, sir.